This guy. That is going to set up again. That's okay.
All right, welcome to order. Welcome, everybody. We have a big meeting today. Thank you all for being here. I guess we'll start with reviewing and revising the agenda. Obviously, our main purpose of the meeting today is to develop the strategic plan of the department, but there are a couple of other things that Drenda will go over with us. Any revisions to the agenda?
I have one just real quick. Although it does say 1 to 4 on the top, it does say adjourn at 3. I was assuming we are probably going to just not adjourn at 3. But one thing's questioning.
Oversight on my part. So,
Well,
we will go till 4.
I think we all know it's until 4. I think. Yeah. Okay.
I want to make sure.
Yeah. No. Thank you. Yes, we'll adjourn at 4. Anything else?
Mr. Chair, the announcement around the SAMHSA grant, I might squeeze that in before we get started with strategic planning, so it's out of the way.
Yeah, that sounds great. So before we do that, let's move on to, any other additions or revisions to the agenda. Okay. So let's move on to the minutes, and then we'll do introductions, and then the SAMHSA announcement. Okay?
I can do the SAMHSA announcement after staff introductions.
Okay, perfect. So minutes, any revisions or corrections to the minutes from our last meeting on December 4th? Over time. No revisions? Everybody, okay. All right, the minutes will be approved. Introduction.
All right, Mr. Chair, members of the board, let's start with our new board member introduction. The city of Helena and City Commission appoint a member to the Board of Health, and sometimes that member changes, and it has. So Melinda Reed had been the previous City Commission representative, and we now have brand new commissioner, Ben Rigby, with us. So really glad to have you.
Yeah, thanks for having me. Yeah, this was, believe it or not, my first choice. So yeah.
Perfect. Would you mind telling us a little bit about yourself and your background? Because sure. I think it's relevant to the fact that you're on the Board of Health.
Yeah, so we'll just go back a little bit to City of Helena. I was the water treatment operator there, worked my way up to water treatment superintendent for about 6 years there. And now last July of 24, I left the city for an opportunity to run a nonprofit called Montana Rural Water. And we help communities across the state with water and wastewater, public health trainings, elected official trainings to make sure that, their water and wastewater is taken care of. And a lot of the smaller cities across Montana, their elected officials are part-time. So like sometimes when they're brand new, like myself, they don't really fully understand the budget and the things that they have to pay for things. So that's what we do at Montana Rural Water. So excited to be here. Worked with I think a lot of the Lewis and Clark watershed group at my time at the city. So excited to be here. So thanks.
Welcome.
Thank you.
Do you want to take a minute and just introduce yourselves to Ben so he knows you all?
Sure. Yeah. Do you want to start, Lisa?
Sure. Ben and I already know each other. Ben, I work for DEQ Public Water Supply. That's how I know Ben.
I'm Shannon Brown. I'm the chair of the board, and I am the representative appointed by the county commission to that's from within Helena city limits.
I'm Kelly Harris. I represent the city of East Helena, and we do use Montana Rural Water often. So, although I've not met you,
Sure.
you've met Kevin.
Yes, yes, I have.
Anna Nash, I'm a family doc at St. Pete's, practicing position, right, on the board.
Yep.
Mike McGuire with the Blue Cross Blue Shield of Montana, and I'm here as a consumer of healthcare services.
Tom Roth, County Commission, and we've met.
Yep.
And Sherry's joined us.
Unmutedly.
Oh, you're muted, Sherry.
App to unmute. Can you hear me?
Loud and
Okay.
clear.
Hi, I'm Sherry O's Mosley, and I represent the people in the county. And I've only been on the board for a little over a year, almost 2 years now, I think. So anyway, I broke my ankle, so I'm feeling good though. Things are going well. So welcome to the board.
Thank you.
I'm so glad you're able to join us, Sherry,
Thank
even
you.
though you're on the screen, but you're here, so.
Yep. Thank you.
And we do have some new staff introductions. I would like to start with Jessica, and her supervisor, Julie, is here. So I'll have her introduce her staff.
Yep. So hi, I'm Julie Brand, the prevention team supervisor, and we have Jessica Dorrington, who started at the end of November in the behavioral health systems improvement specialist role. She's been rocking and rolling since then. And I'll let her say a couple words.
The pleasure to be here and to understand the inner workings of county government. So I come to this position from a very large healthcare system, the Organizational Development and Innovation Division from Alaska, and focused on behavioral health systems improvement and planning and grants. And I am happy to be here now. I've lived in this community for the past 11 years, so some of my work was remote. And this is the community that my husband was raised in, born and raised in, and that we're raising our family in. So it's great to be able to apply some of what I've learned over the last 20 something years to helping out here in this community. So thank you.
Welcome. Thank you.
And then our other two new staff members are on our administrative support team, and I'll have Sandy introduce her staff.
Very, very excited to introduce. I'll start with Caitlin. If you want to have a stand up there, Caitlin Kimball joins us. I'll let her say a few words about herself. Our A team will be sharing all of our administrative duties, but right now it looks like she will take a lead for billing as well.
Hi. I am incredibly excited to be here. I only moved to Helena a little under 2 years ago. And I've quickly found that this is the community that I want to be a part of. So to be on a team of people that are affecting the community in such a positive way is an honor.
Thank you. And then we have Jenny Hoff, who is right now kind of heading up immunizations, who has joined us. Go ahead, take it.
So I was born in Kansas, moved to Butte, moved to Townsend about 5 years ago. And I'm just really excited to be here. I've worked for the state before. Came from the veterinary office in Townsend, so this is quite a change of pace, but I really enjoy it and I love my team members, so yay.
Thank you. Welcome to both of you.
Sandy has a brand new administrative support team as of the last 6 months. Like the whole team is brand new, so.
Brand new, yes.
Yay.
So we're very excited. Time to get busy.
Yeah.
So those are the introductions I have for you today.
Thank you. We'll move on to announcements.
Okay, so I wanted to just take less than a minute to let the Board of Health know that just this past week, we had some chaotic correspondence from the federal government. So SAMHSA stands for the Substance Abuse and Mental Health Services Administration. We get $125,000 a year as a 5-year grant. And it is intended to do suicide prevention work in our community. Last week, on the 13th, we were notified at 7:30 at night that our grant was terminated as of the 13th, so no notice. So we quickly met with staff, made a plan, had a good plan to keep her employed and also keep the work going and try to transition. without having those funds. And then within 24 hours, that termination was revoked. So we got another notification from SAMHSA that, oh, just kidding. We're not going to terminate the grant after all. You probably all heard it in the news. It hit national news. It was quite a scuttlebutt. It was $2 billion worth of SAMHSA funding across the nation that had been terminated in a short amount of time. So we were really grateful to get the notice that was revoked, and we are getting the money, and we will continue to do that work. I did send, so there were since then the Congress has been working on the appropriations bill. And some summaries that have come out on conversations that from Congress is they're expecting some accountability and some transparency from the departments when they intend to do any terminations. They're expecting communication to come to Congress at least 3 days prior, and that language has been written into the appropriations bill. So if the federal agencies comply, we shouldn't be caught off guard. We should at least get 3 days notice. So because the termination was revoked and Congress has actually communicated with the agencies that this wasn't okay, I sent a message on behalf of public health to our state congressional delegation and just let them know that we appreciate their support and help them understand how that money is being used in this community. So giving them some communication from us, like we appreciate that the money is still coming, that it's not terminated, and the accountability and transparency language in the appropriation bill will help as well. So wanted to let the board know that correspondence with our state delegation has happened.
Thank you. And Brenda and I just happened to meet, have our regular meeting right after that had happened. And so I just want to commend the work that you did, the preparation that you had done. It was really obvious that the department was prepared for this to a degree. It obviously wasn't ideal, but like Brenda explained, very quickly, her and her team were able to come up with a plan so that there wasn't any immediate impact to personnel and to services. That was as drastic as it very well could have been, and probably was for a lot of other programs funded with that money. So, I mean, not ideal circumstances. It worked out in the end, but also great work to you in that really difficult situation. That was really challenging, and it was very fast moving. So great job being agile and responsive to that.
Thank you. Yeah, nothing like your heart skipping a beat there when you read an email that things are changing fast. Yeah. So.
All right. I think that's the only announcement.
Yeah.
All right. So I guess now we will transition into the quarterly finance report.
And this is going to be quick and down and dirty as well, just so we can get to strategic planning. So on page, what page is that on it's page 7 in your packet is the finance report for second quarter. So we halfway through the fiscal year. If you look at the top of that page, it's the revenue section. And if you go clear almost all the way to the right under the column that says percentage of budget collected, we are at 57.82% of revenue at 50% of the way through the year. So we've collected more revenue than we anticipated at this point. The next section down, these are personnel expenses specifically. And again, if you move to that, the column on the right, labeled percent of budget spent, we are 51% spent at 50% of the way through the year. And then if you go to your next page, these are operation expenses. So I'm going to just take you right down to if you go across the spreadsheet to the budget spent column, which is the second to the last column on the right-hand side, and go all the way to the bottom. It says it's the total operations spent. We're at 33.38% of our operational budget spent halfway through the year. And then two more numbers that I'm going to point out to you. In the middle, there's a area that's called cash flow. The ending cash as of the end of December was at $1.4 million. And that equates to 174 days of reserve. Our goal is 90 days of reserve. And so we're well above that. And we are well above where we were this time last year, almost double where we were this time last year. So in really good financial standing halfway through the fiscal year. Any questions?
And Mr. Chair, if I might, I just think that the staff need to be commended for the way they're approaching the possible the uncertainties of where the money's coming from. And there's a lot of things that need to be done. We depend on the feds and the state to do that. And with the uncertainties, I think they're doing a great job of trying to do it, to be cautious and be prepared in case something were to happen. So I think they get a lot of credit for doing it right.
Thank you.
Yeah, thank you.
All right. That's it for finance report then.
No question? Good. All right. Well, we will move into agenda item number 5. 5. Our 2026 to 2029 strategic plan development. The big item today, I will turn it over to Brenda, who has worked quite a bit with Fred and with other people within the department to set us up for success in this process. So take it away.
All right. Thank you, Mr. Chair, members of the board. I just want to first bring your attention to page 10 of your packet. That's where that's one of the handouts that we'll be referring to. It's our current strategic plan, mission, vision, and initiatives. And then there, if you continue to scroll in your packet, the next section is the SWOT analysis that was conducted. I wanted to make sure that you have that in front of you. We do have a couple of extra copies if you don't. And then the KPIs, or the key performance indicators, which start on page a little further down, start on page 34. I would like, you'll be getting a new version of that. So the one that's in your packet was preliminary. We got it in your packet as quick as we could so that you could see and be able to review and digest that before today. But we do have an updated version. We've made some changes to language. We've added some baseline data that we didn't have at our fingertips last week when we sent the packet out. So you'll be getting an updated version of that. So I'm making sure that everybody has, make sure you have all of the handouts that you need. Looks like Mike's going to go ahead and pass that around. And then at this time, I'm going to stop talking, which is going to be a pleasure for you all to listen to somebody else. And so I would love to introduce Neva. Neva is our facilitator for the session today. I'm thrilled that she was able to be a part of this process with us. I'll let her give an introduction of, she works for the state of Montana in the Systems Improvement Office and is trained to do these types of facilitations. And we've been working hard to collaboratively plan this. And so I'm just going to hand it over to her and let her take it away.
Do you want to give a little bit of background on the last one and how we kind of?
Yes. You want me to do that now? Or do you want to introduce yourself?
Okay. Yeah, we'll do this. Like I said, my name is Neva Loney and I work for the state for DPHS and our Public Health and Safety Division and System Improvement Office. So my position, I get to go around the state and work with the local health departments. And so it's a really fun and exciting job. And like Brenda said, we work with a lot of the health departments and helping them develop their strategic plan and also community health assessments and things like that. So we do have kind of a packed session today, but hopefully it's going to feel really collaborative and have lots of space for discussion in deciding the strategic priorities for the health department moving forward into the next 1 year. And Brenda will decide that, and then we'll go over exactly what we'll be doing.
Okay, thanks. Did you want to talk about the agenda, or do you just want me to jump in?
Well, yeah, why don't you just kind of
Okay.
describe the background, and then I'll hop over to this.
Yeah, so the Board of Health is responsible to set the strategic priorities for the health department. And we, as a health department, have developed a strategic plan every 3 years. And so we'll talk a little bit about the current strategic plan, mission, vision, values, and the initiatives. But just going back 3 years in time, the Board of Health really did set those strategic priorities, the initiatives, and then the processes, the staff will take it from there and kind of flesh out some of the activities after you've set the priorities. And so that's essentially the purpose of today's session. In the last strategic plan, what we found trying to implement over the last 3 years is that it was awfully large. It was probably too much for our capacity. It went above and beyond what our capacity was able to accomplish. So it ended up being 40 some pages long with really great ideas as far as goals. We didn't do a very good job setting like measurable objectives, which then made it hard to measure impact as we were implementing. And so those are some of the challenges that we ran into implementing the previous strategic plan that I'm hoping we can resolve in this iteration of the strategic plan. So we're going to go at this in a little different way. I think Commissioner Rolfe, you're the only one that was with us oh, no, Lisa, you helped us develop the last strategic plan as well. So kind of forget about the process we used that time around, because we're going to do things just a little bit differently this time. But I just want to point out that it is the board's kind of oversight responsibility to set the strategic priorities, and that our hope through the session today that we are going to be able to focus on ways to have greater impact in our community and impact the overall health of the people who live in this jurisdiction. We think of it as a roadmap. So we have it's a 3-year roadmap, but we're going to tackle it 1 year at a time. But that roadmap will keep us kind of going in the same direction, on the same road, kind of working collectively, and having hopefully really great impact from the work that's happening. So I'm hoping that we can capitalize on the strengths that we have in the health department as we build out the strategic plan. And so with that, that's kind of the background and the purpose of why it is that the board even engages at this level. It's really, you have the ultimate responsibility per Montana code to set the direction of the health department. And so that's why we're here today. Any questions on that?
Okay. So just to, I'll go over, we have a kind of loose agenda, and there's some space in here for us to kind of change as we see fit, and make some changes if needed. Because it's a little bit different than I've done working in strategic planning anywhere else, because we're starting with our indicators first. But anyway, Brenda just provided the background. We're going to spend some time talking about the mission, vision, values of the health department. Just as in any organization, the mission, vision, and values really is the guiding light. You know, why are we all here? Why does staff come to work every day? How does that resonate with our community? So we want to spend some time making sure that those kind of align with where we're at in this moment. So that will be the first thing that we do. And then we're going to go into some KPI prioritization. So I've kind of listed out again, kind of a loose agenda, but we'll be looking at the KPIs that were hopefully sent out to you, and also that hopefully got a chance to kind of take a look at. And then again, trying to make sure that those align with where are we right now and where do we want to be in the future. So we'll have discussion around that. And then we'll spend some time prioritizing which of these are the most important to look at and what do we really want to focus on. And then you all will have an opportunity to vote on which ones you think or bring new ones to the table. And then finally, we'll have some time for closing at the end. So any questions on the agenda for this one? Okay. So let's start with the mission, vision, and values. Does anyone in here have them memorized by chance? Anyone recite them? No. How about, is there like one or two volunteers that could read them for us?
Sure. I will start with the mission. Currently, our mission is to improve and protect the health of all residents of Lewis and Clark County.
Someone want to read the vision?
I'll read the vision. It's healthy people, community, and environment.
What about the value?
I can read that. Leadership, cultivating a proactive and forward-thinking approach to public health. Collaboration, working together for health improvement. Inclusiveness, ensuring equitable opportunities to lead safe and healthy lives. Effectiveness, using best practices effectively to achieve health improvement. Integrity, serving the community professionally, honestly, and dependably.
And I'm wondering if we could just go around the table and if each person can kind of say a word or two about something that they've noticed in the statements or mission, vision, values, or something that stood out to them. One or two words. You start here because we're waiting.
So thinking about from the collaboration perspective, I know, in my work as a family doc, both in primary care and in obstetrics, we send so many people to the health department for different testing and vaccines and for a ton of women's and children's services. So that collaboration part is super, super important and core what the health department does.
For me, what jumped out was effectiveness, using best practices effectively to achieve health improvement. I feel that one of the drivers of best practices is getting the best data that we can to make, confident decisions based on data, not other issues.
I think just going on down, that the integrity piece seems very important, to make sure that we are really taking care of, straightforward manner. So.
As I read this, I think there's a real focus, and everything is sort of through a lens of like the collective, like sort of everything true to public health, right? Like everything is sort of looking at the community as a whole, not to the neglect of individual people, but sort of how, the kind of state of what the collective status is as far as health goes for the county, how, relationships are within the group of people, very much focused on sort of people kind of acting in concert or being together or being part of like a community or a group.
I would speak to the vision statement. I just like the concise and direct nature of it. It seems to boil it down to the very, very bare bones and perfect. I like it that way.
I will say that from my sort of environmental lens, I appreciate that health departments are not necessarily focused solely on the medical disease part of public health, but also those environmental factors that lead to some of those medical issues. So that jumps out for me.
For someone online.
Yeah. Do you want me? So I can't see. I don't know. I pushed a button, so I can't see you guys, but can you see me or hear me?
Yes.
Okay. So I guess mine would be leadership, cultivating a proactive and forward-thinking approach to public health. I think that we need to start thinking about some of the stuff that's coming down from MAHA and incorporating that into local health and being open-minded to some of the new science that's coming out. That's all I have to say about that.
Thank you. So the next question's for everybody, but how do these statements make you feel? How do you feel when you read through these, being a board member?
Proud that our community and our Board of Health engages so well with the community, and that we have hearing people in the health department that understand community issues specific maybe to certain health outcomes.
Yeah, I agree. Like definitely proud, definitely really appreciative of how sort of comprehensive this is, but also a little bit like this is everything, right? It's sort of like values, all of them, all of the values, right? So it does seem a little I'm really again proud that this is reflective of the organization, but at the same time it's so expansive, and it really is sort of setting this expectation of covering everything all the time, like even from the values perspective. I think effectiveness, inclusiveness, collaboration, like some of those things would have to be prioritized over the others in certain situations.
Oh, all right. I don't know. My turn. I'm awful at the question. How are you? Tell me about your feelings. So like, yeah. How do I feel? I think this is very thorough and good. I'm glad people are doing it. Feelings are not where I'm probably gonna go.
This is open to anyone. You don't all have to respond to that if you don't have a feeling about them. How do you think that these relate to the community impact, the mission, vision, values? Or does it?
Well, I mean, community impact certainly I would expect would be prioritized given these frameworks of thinking about issues. What specific impacts, impactful actions are measured, I think. I don't know, but as far because again, this is super general and very broad for the department, but I do think I think there is definitely a focus on the community, right? Like I said previously, on the kind of collective community. But it's not super clear about what impact is expected or how these would translate into like impactful actions, or what would be a pro or a con in evaluating what impact we're having necessarily. Because I think of that.
impacts are often direct results of formulated plans and actions from those. And I think that it starts with things like these people determining what is important first.
Do we think that these mission, vision, values still resonate in this time?
I do.
Yeah, I don't think anybody doesn't resonate.
Yeah.
Right. Thank you for that. And so for this next part, we're going to look specifically at the values on here. And so when we were discussing this, what kind of came to my mind, we're going to go through each one of these and kind of talk in the group about what does this actually look like in practice. So if like you were, you know, like walking around the health department, or you had, you know, heard something about some work that was going on, that you could say, that's good collaboration or something. And what had come to mind when I was thinking about this is when my daughter was in elementary school, they had Proud Paws. And so it was, I can't remember all the things, but it was like being kind or responsible or, you know, whatever. And the teachers would hand them out to the kids. And it was like, I saw you being, you know, responsible today. And so for each of these, going through, and I'm going to take some notes here as well. So if we were looking through these, and we can start with leadership. If we were looking at leadership, and we're like looking around the health department, like what would be an example, or what would good leadership look like?
Want to stand up, Brenda, or?
Rob?
You want to
Well, I was gonna say, we heard that story today.
yeah.
You know, with the Grand Green canceled, you know, there wasn't panic, there was urgency. There was a plan made to keep staff, keep the programs going. That is an excellent example of leadership.
So like, responding.
Right, cancellation.
Pseudo cancellation.
Yeah. Well, it did
Yeah. They send you another email. It's like psych.
JK.
That would have been nice. Then we could have laughed, right?
Or I mean, not.
That is a good example. What else?
I would say that from my experience working with those who work under Drenda, that she leads by example, and that the other supervisors and staff know their roles and can perform them flawlessly and don't require a lot of direction. For me, my pet peeve is asking somebody a question and, oh, I got to go ask somebody who has to go ask somebody who has to go ask somebody. And that's not what happens here. I think Drenda empowers her staff to provide answers, questions, services to those who are inquiring or in need of those.
Yeah, I don't work for Drenda, but Bill Colin Powell mantra of having clear and obtainable goals and a direct plan with which to obtain those is very much seen when I see her work. So it's clear and obtainable and a plan to do those exactly.
I would also say, in addition to all of that, like, for example, I think like we see the sanitarians work, like we scrutinize the sanitarians work more than probably anybody else's within the department. And I think their demonstration of being really taking charge of that process of wastewater variances, wastewater variance requests, and really working for the most part. I think we see them really working with applicants, really taking the lead, really taking responsibility for their representation of the department when they're interacting with members of the community who are going through that process. So I think that's a really good example of not necessarily like supervision of other people, but individual people taking leadership within the department by really taking full responsibility of their work and really directing what's within their control to sort of align with this proactive sort of forward thinking, really strategic decision making at every level. That was a lot of.
Trying to capture that.
Yeah, and even in addition to that, the thorough nature in which they report that to us is so appreciated.
Yeah. Yeah. And being able to anticipate, what other people need when they're going to be reviewing this, things like that. Like, I think that's a great example of leadership where they're really going above and beyond sort of and kind of making the work their own.
Anything else? With leadership? Something comes to mind, we can always come back to this as well. We'll stick this over here because that doesn't look just right.
Every time I hear that, we've done something.
What about collaboration? What does that look like?
I can speak to this a little bit from the East Helena perspective. Obviously we're the Superfund site in the room. So awesome. But there's not a theme that goes on that they don't not only collaborate with the leadership of East Helena in the community, but the citizens. So they're very involved from the top down, bottom up. Everybody in the community is involved with any sort of health actions in that area. And I think that's, from you're dealing with a lead cleanup. It's not a simple issue to convey that message. And it always comes, through the leadership and as well to the citizens. So I think that's important.
I think is it the CHIP that happens every year? Is it the annual one?
3.
What's the community health assessment? What's the one that happens every year?
Nothing happens
The
annually.
annual-
No, just our strategic plan report out, but
Oh, just the reporting of the street. Okay,
yeah,
I
and
see.
the reporting of the CHIP happens
So it is-
annually.
okay.
Yes, but
So
the
it is the
development
CHIP.
is every 3 years.
Okay, the CHIP is what I'm thinking about, where I think the department really leads that, right? I mean, and that is comprehensive across the community, healthcare providers, human service providers, nonprofits, just like I think that's a great example of the health department collaborating and like staff across the board, I think collaborating with external stakeholders, but also kind of leading the work. And I think we do that with several things. That was just the one that I could think of. I think if something needs to get done that is cross-cutting across community interests, it seems like the health department is really, health department staff are really quick to step up and say, we will lead the charge on this and we will coordinate this, which is obviously getting the work done is essential to, I think, collaboration.
Chips happen way more than once a year in my life.
This feels like it happened.
Probably not the first thing on the vision statement, but I'm saying they're delicious.
What else? What does good collaboration look like?
I think that does a really good job of collaborating with other providers within the community and other entities within the community, as well as other departments that can work towards a common goal, whatever the problem is at that time. They do a good job of engaging other people who have the same sort of tasks to reach that goal.
I think board composition is another aspect of collaboration. We have laymen to professionals, all points in between, government officials, physicians, a pretty diverse cross-sectional board membership.
Anything else with collaboration? Give proud pause on.
One of the things that I think that's to be successful is you have to, when things come up like it's come in the not too distant past, where there's really hard feelings and divergent feelings, you gotta recognize that people have a right to disagree with it. And I think that's a really important part of being credible when you collaborate with, that the people feel like they all have a voice at the table.
See, Tom's awesome with the feelings questions. You're close to him.
Can also be an observation. Take feeling / observation. Okay. Very exciting. Okay, let's see. What's the next one? Inclusiveness, ensuring equitable opportunities to lead safe and healthy lives. What does that look like in practice?
I think that, to me, that means that the programs that they administer, operate, are directed towards everybody. There's no, like we call in business, there's no market segmentation. Right? This is broad-based. It's for the county. It's not for this neighborhood or that neighborhood. Right? It's for everybody.
What else? One that I see, so thinking of equitable as, helping everyone be on equal footing to have the same opportunities. One that we see in the home visiting world is ones that really focus on mothers who are likely to need additional support, thinking about helping babies have the best opportunity to lead healthy lives.
I think very related to that is maybe just said more generally is the ability to sort of proactively understand who is going to have more barriers to services so that we can account for those, versus waiting for people to say, oh, I have this issue, trusting that people will have the wherewithal to bring that to our attention. But being able to anticipate it and try to build that into standard operating processes.
Ensuring equitable opportunities to lead safe and healthy lives. Is there anything else that comes to mind?
I was raised in a kind of an unusual circumstance where my family doctor was right across the street from my dad's store. And he was part of our life growing up. And I think as I've gotten more involved in these sorts of efforts, I realize there's a lot of people that didn't grow up with that incredible closeness to a family physician or to medical professionals. Some of them are really a long ways away from them. And I think we have to make it so that people they feel included, they feel connected. We have to try and find ways to connect people, or help make it available for people to connect with their needed medical services.
I think I think one of the things good about it was to have a broad range of people that understanding all the issues that could affect the general and greater public health. Like, I can have you detailed conversations about the effects of lead and how it does something, but like, breastfeeding issues, I'm not going to be very helpful. But like just having like all the people who have all these, like, the things that can affect all public health, and having a broad range of people with different diversity there matters.
Mm-hmm.
So, like, diverse knowledge on health issues.
Yeah. Broad ranged things that affect public health. Something can pop in your head. You probably tell you a lot about things that can pure your water.
I think for me, inclusiveness means meeting people where they are without judgment.
Yeah. That should just be the sentence right after it. We should just run with that one. Scratch that out. That's a good one. I think where it heads at.
Mm-hmm.
You don't post a lot. No thanks.
Like I said, if anything comes to mind, always add Wi-Fi. Okay. What about effectiveness? So using best practices effectively to achieve health improvement.
Well, I think I mentioned this before. To measure effectiveness is all about having good data, right? And it's not the popular data at the time. It's that data that we've collected over decades that we know is an established, effective means of achieving public health. To me, that is extremely critical.
We're willing to just look in the mirror and just judge how the effectiveness of your programs. We look at this all the time. We're constantly looking at, your ratings of all the programs and stuff in this board. We're constantly looking at how are they working. Here's what we're seeing, and there's an honest assessment all the time. And the willingness to look in the mirror and go, how's this working? It matters. What we call that self-scout. I don't know. It applies to you.
I think also what stands out to I agree with what's already been said, but I also think that those points are like, there's a whole kind of discipline of like program evaluation that I think this could be more generally applied to sort of suggest that people are engaged with their subdisciplines and the kind of broader professional sort of organizations or broader professional standards that govern what their particular functions within the department. I don't think everybody's going to be able to collect data and do like program evaluation on every single thing that they do necessarily. But as far as across the kind of at every level of the department, really being connected to professional groups that set and assist, provide technical assistance with professional standards and meeting those.
I think to be effective, you have to understand the practice or the process.
I feel like this mark is really loud too. Maybe we could just like me. Things quiet in this room.
Yeah.
Yeah.
Deer in headlights.
The thing I'd like to put under measure is KPIs, good quality KPIs, and then secondary metrics to support those KPIs.
What's KPI?
Yeah, for the lay people in the back.
Performance indicator,
No, pardon me?
a key performance indicator.
Okay, nice.
That's this stuff with the KPIs for.
What's on here? Look at you. Look at you with your fancy reading.
Only with my glasses.
I know, that's show
With my
off.
glasses on, I can hear better too.
Just make an acronym. You just took those 3 words, made a little acronym, like, look at me.
Yeah, sorry, I shouldn't.
I can't hear you. I don't have my glasses on.
I think another key thing to effectiveness is the ability to pivot. Sometimes there's one aspect that is the most important. I don't want to go back to COVID because we've wiped that from our memory, but the ability to pivot to what the important thing is of that day or that year or that 2 years, whatever. But for me, that's how you show how effective you are. It's like, I know all these things about broad topics, but when something emergency wise comes up, I can shift and focus my energy to understanding and figuring out how to deal with, handle whatever that thing is. So pivot's the best word I could come up with.
Yeah. I'm building on that too, in addition to kind of focusing on the necessary area when it becomes clear that an existing thing isn't working, being willing to kind of cycle through and make changes.
And good data helps us with that. Yes.
Okay. Anything else for effectiveness? Let me try to squeeze this last one on here before I switch over. What about integrity? Serving the community professionally, honestly, independently.
It's probably what ties all the other ones together. If you don't have those things, the trust in the community, everything else you're doing isn't it. I mean, it's not only a reflection of the other things, but it like circles back to like, if they don't have that, you won't get those other things from the community. You need to have those, you need to have that trust. And if you're honest and dependable and professional to the community, that's how you get these other things to be effective.
That's it?
Yeah, this is to me, like Kelly was saying, kind of repeating that it's a foundation to make sure that our other 4 values are strictly agreed to.
It seems to me that one of the things that helps to show our integrity is that applies to health is that epidemiology with looking at real numbers and not just the numbers you want to see, are the things that help prove that we're doing the right thing. And sometimes the numbers might not show what we'd like for them to, but we have to pay attention to what the real facts are.
I would also say that this, to me, if we're thinking about professionalism, honesty, dependability, the development of consistent policies and procedures that everybody, that kind of affects at least public-facing positions across the board that are legally compliant, like those types of things, those boring things, I think, though, really help. That's what I think of when I think of kind of professionalism, dependability, when we're talking about public serving roles, is that there are clear policies, there's training of staff on how to, work within those policies, and there are consequences if they aren't followed. I think that as like the most pragmatic way of thinking about it would be through that sort of policy implementation and compliance. We're about.
Okay. We're just about right on our schedule. Anything else to add to integrity? Well, we're going to circle back to these in a little bit, but we're going to review our API.
Nice. I'm gonna use that later.
Use a new acronym, maybe. Did you want to kind of explain this all?
Yeah.
So, sorry.
So key performance indicators, we started talking about this a couple months back here in the health department of wanting to find a way to take our pulse, right? To have, I guess, to speak in Dr. Nass terms, like a lab panel of our health. And so did a little bit of research on how the best way to do that, and came up with this model. And this is a standard model that's used kind of across industries, both government and for-profit and nonprofit industries, to really kind of take the pulse of your health, of our organizational health. And what you see in a typical breakdown of key performance indicators is that they fall in these 4 quadrants. So we want to look at financial health, which is in the top left quadrant, customer service or satisfaction, which is in the top right quadrant. The bottom left quadrant is all about our operational health. You can see from the most up-to-date version that you have in your hand, and then Sandy, I think, is trying to show so that Sherry, we updated it since the packet, and so it's right here on the screen. If hopefully it's really hard to see. Zoom it up. And then people and culture is like internal, our staff within the health department, and the culture around engagement is that last bottom right-hand quadrant. And so if those are the kind of general areas in which we need to be focused to measure our health, what are some of the specifics within each of those quadrants that would give us an indication if we're on the track going in the right direction, or if we're falling off the track, or if we've done fallen off the track? How are we doing? And so we have worked over the past, I'm going to say we, but really Fred has worked with each of the programs over the last couple of months to identify key performance indicators that represent what we think are good indicators of health within the department. This is a starting point for the board to consider. What you see are items that we believe are a good indicator. And then in the second column over, that is where our baseline or our current metric is. For those that we have a metric for, you can see that we have some missing baseline data. And we'll work over either the next month to get that number plugged in, or over the next year, because that's a strategy. We need to like collect the data we want to measure it, but we don't have a way to measure it. So that might be an issue with that baseline as well. So that's in the current column on the spreadsheet. And then the red, yellow, and green, these are the values that represent, are we doing well? Are we verging on falling off the tracks, or have we done fallen off the tracks in the red? And we need to put some real energy into figuring out how to get back on track again. Again, these are up for discussion. We'd love to have the board's input on the items that we have selected as a key performance indicator, or any of the values that we have assigned to the green, yellow, and red categories. I've color coded them for you so that you can see, like, we'll just look at financial. For financial health, the very top item is a 90-day reserve. And as of Q2, which I gave you that report earlier in the meeting, we are at 174 days, which actually falls in the red because our goal is 90 days. It seems like that's a really good thing to have more money than we're supposed to. And in some cases that is true. But when you're a government entity and you are restricted on how much you have in the bank account, or there are ramifications or consequences to having too much money sitting in the bank account, we really do need to aim for 90 days. And so that's an example of like our thought process, right? And what you're seeing on the spreadsheet. Fred, what would you add? Because you helped put this together and you worked with the teams to think through, especially like the individual programs really did the lion's share of the work in operations quadrant of the.
I think the only thing that I would add is we decided through a lot of conversation that this isn't a place where we're going to measure everything. One of the things we thought was important to sort of acknowledge, and the reason we can take this approach as opposed to the 48-page plan, is we may be having a strategic plan elsewhere. Look, we have a CHIP implementation plan, we have program plans, we have a lot of activity that's happening, right? So we wanted to pull out what are some of those key indicators that say we have a healthy organization that's going to be able to accomplish all that. Mm-hmm. And so when you look at some of them, there's likely a dozen other things we could measure in each of the programs, but we tried to pull out the ones that really made sense. And in some cases, we were surprised, right, where we were. Well, we're really good at this, but then we sort of go look back at the numbers and say, oh, we could actually improve quite a bit. And so they put a lot of thought and time into deciding where they think we should be. In a lot of cases, I would even attempt to give them a little bit of an out, thinking, yes, but here we've been and we're being successful in doing that. And I would have employees come back and say, no, this is where we should be shooting for. So it'll be a great conversation to run through. I think there might be some explanation on some of the individual ones, so feel free to ask. But that was the approach. So this is the subset of key performance indicators that are important to measure in the next year.
And is orange, we don't have data?
Correct, at this point. Okay. So, and I can, there's only a few of them. So let me just take a minute. So the first one that we do not have data for is the % of CHIP activities assigned to Lewis and Clark Public Health that we have implemented. Because the CHIP is a community plan, right? So we're responsible for some of that work. And we won't know the baseline until after the first year of the CHIP, which will be this summer. We'll plug in a baseline number there. The next one down, and I'm in the operations quadrant, so hopefully that'll help you follow. The next one down that doesn't have a value is % of women in home visiting services who screen positive for postpartum depression that are connected to a mental health provider. We have that data. It was just waiting for program staff to give it to me. So we'll be able to plug that in. The next orange is in the upper right quadrant, which is about customer satisfaction. So the percent of customers that agree or strongly agree with the statement overall, I am satisfied with the services I've received on the satisfaction survey. We are just right now starting to implement our new customer satisfaction plan. So we don't have a baseline. We'll have to collect data first, and then we'll have to implement our customer satisfaction and then plug in that data. Next one down is number of voicemails per 8-hour day. That is a desire of our administrative support team to know that, but they haven't been collecting it. So they're going to start collecting it now, which will then give us a baseline there. And then we have 2 that are in the people and culture. The first one is percent of frontline staff and supervisors who are proficient in strategic skills that are most important for their roles. We have that. We just need to get it plugged in because it came out of the workforce development assessment. And so we just need to, I'm waiting for our epidemiologist to crunch the number for me. And then the last one is average number of unplanned absences on the A team or our administrative support team per month. And again, that's a desire of theirs to track, and they haven't been tracking it. So they're going to track it starting moving forward. So we have for those items that we don't have a baseline, we have a plan to get the baseline within this first year. Is that helpful?
On the 2 of the 3 reds in the operational quadrant, deal with lead testing, specifically the East Island stuff. Someone speak to those and the anticipated, like, they're both red. They seem to be lower than the numbers you're wanting to achieve. Just some conversation on that.
Yeah, some context. Steve Tennis is our sanitarian assigned.
He's up there messing with that cat. Tommy didn't get the test out there.
Yeah. He's new with the health department within the last year. And so this is his desire to have a focus on first time tests and for both children and adults. And this is his this is his desire to aim for something much greater than what he's accomplishing right now.
Okay.
So
are we going to talk about these individually as things going forward, or are we kind of talking about broadly what these mean at this point?
I'm happy to answer whatever the questions are about them so you understand the context behind them.
Okay.
Neva's going to walk you through an exercise that will allow you as a board to have discussion about them and prioritize. Those that you prioritize will end up in the strategic plan.
Okay.
We will be monitoring these and reporting back to the board on all of them, but we're only going to do strategic planning around the ones that you prioritize.
Okay.
So we'll be monitoring all of them, but only like working to improve on a handful that you all decide on. That help?
It does. For ones like the first time children testing, for absolute numbers that are also accomplished by other organizations in town, like that's a primary care responsibility too.
Yeah. Yep.
How are numbers for those types of things set where it's not just public health?
Right. Yeah, we are there. That is a challenging metric, which is why we focused on what our staff is doing, because we don't have a way to collect all tests being done in the community. So I know it's probably a health insurance piece of information, but Medicaid, Medicare, health insurance. But at this point, the only data that we have that goes beyond the work that we do in the health department is the positive results. We get all of those, but we don't get a number of total tests done in the community. So
this is sort of a philosophical question from a public health perspective, but if you want to take the most upstream public health focused approach, I mean, the health department could be testing 100% of the untested children and it could still be 13.
Yeah.
Yeah. And it would be so valuable from a or there could be, 95% of children untested and we're only testing 13.
Yeah.
To know the absolute rate in your county for something high yield like lead testing.
I think our program is absolutely on the same page that you are when it comes to our this is something that we have control over. Right?
Yeah.
It's all what you're talking about are also strategies that we can use to achieve the goal. So I appreciate your comments, and I hear our team talking in the same way that you are.
Yeah.
Like they really do want to figure out a way to understand the total tests done. But right now we're gonna focus on what we're doing.
I would just add to that too. So the great thing about a lot of this exercise is that we started thinking in those terms. And even if we can't capture 100%, one of the recent conversations came from this is there's really two primary pediatric providers. And so even if we had multiple points that we could triangulate, we'd see if there's trends going up or down in those three, because we just get raw numbers, not tied to identity. That would be really interesting. That would make the data more interesting because we'd see that there's a disparate number. We see that they're going down. We're seeing that we got geographical distribution. There's a bunch of interesting data, even if we're not capturing 100% of the interesting. So that teams are thinking in those terms, and without a solid discussion.
That's been a conversation that's ebbed and flowed. Because there's a lead coalition that there are providers that come to that table and they've really thought long and hard about how to do that. And we haven't come up with a good solution yet.
So I'm hearing that those two metrics are important.
Very important, and not to in any way undercut the importance of it as a KPI or the work that the teams are doing. That raw number without a lot of additional context tells us very little about how we're doing.
Yeah.
So, I mean, this is quantified. I imagine that the team doing this work has a lot of kind of qualitative data that they come in contact with, even if it's not systematically collected, but they understand qualitatively in the community what needs they see, right? So I imagine that if their judgment was this is red, that based on their experience and their involvement in the community and their expertise in this area, that is they recognize there's like a need not being met there.
Yep.
Is that a fair assumption? Okay.
Yeah, but I think again, without the full understanding of all of the tests being done.
Yeah.
Our staff are saying we can absolutely do better with our own internal program.
Thank you. And this is sort of why I asked the question about getting into the nitty gritty, and this is probably an issue for a different time, but that should be something St. Pete's can pull from their electronic medical record, someone who knows how to do it, about 15 minutes. Yeah. I will get to that.
We have action. I wanted to add just a couple of things before we get into this discussion. First, it should be no surprise to you all that Drenda is kind of like leading and came up with an innovative way that I haven't done this before, of starting with the QPI. So we're kind of, or the KPI. So we're a little bit, for me, it feels like, okay, where's this going to go? Like we have an endpoint in mind. And so you guys get to be our guinea pigs and seeing how this process is going to work. And I'm really excited because I think it's great of, starting with these KPIs and kind of going from there. So I just wanted to add that, instead of usually starting off with these, goals or whatever, and deciding there and then breaking it down. What we're asking of you all is to sort of, look at these and look at the values and make sure that we're measuring the right things. And then from this meeting today, to take this back to the health department and say, what are the strategies that we're going to implement as part of the strategic plan to change whatever metrics we decide on? So we'll kind of walk through this process in the next couple hours or so. So I want to say that. And then also in terms of public health and accreditation, one of the things that is really important is the linkage back to the CHIP, which has been brought up. And so we, really want to make sure that those two things go hand in hand. The idea being is that, the CHIP, as we've talked about, is that community-wide, broader effort. That's the collaboration piece. And then this strategic plan is really focusing on the internal operations of the health department to ensure that, they have, the resources that they need, that they have the staff that they need, that they have the access to training or equipment or whatever it is to make sure that they are able to implement the things in the CHIP. And so, those are all kinds of things that, that we want to look at and see that there is that language and linkage there. So I just wanted to touch on those things, but I guess in terms of, the KPIs being tracked now, we had a couple minutes to sort of look through the list, but was there any that stood out to people as being really critical or that might be challenging in some way, maybe mission critical ones?
Basically speaking, percentage of grants spent down is hypercritical because ultimately you're going to have multiple grants with different timeframes. And you're never going to be in green there. You're just not plausible.
That took the number that the 56 took into consideration all of the different in the last year, all the different ending dates on our grants. The ones that we were not able to completely, we turned money back because we didn't spend it all, kind of situation. So
and if you had, you just got more days of reserve. So it's the same, same thing. So you're just.
We're trained to be extra efficient with our money.
Which is a good thing. And it's, I'm sure, very beneficial in instances where you get fake, we're cutting your funding off emails.
Are we focused on the financial quadrant right now? Is that
any quadrant?
Okay.
Quadrant. We can't talk today.
And also take in mind the SWOT analysis that was done and provided to you. So that again was effort that Fred put in with each of the programs to identify what their strengths, weaknesses, opportunities, and threats. So keep that information in mind as you walk through the next phase of this process. Where understanding the KPIs, when you get into building some criteria around selection and prioritization, keep we want to be strengths-based. How do we build on the areas that we're currently strong in order to do the things that you find as priority?
Daily deposits error rate.
What I was wondering.
Sandy,
It's pretty bad.
Daily deposit error rate.
What that refers to is at the end of the day, a deposit goes to the finance coordinator. The deposit represents money that was either collected from a patient at the time of service, insurance payments that have been posted, and from environmental and licensed establishment, paying for plan reviews, septic permits, things of that nature. And so at the end of the day, the report goes to Heather. Every penny of those dollars, regardless of where they were collected, are categorized to a plan review or to for immunizations. We have certain categories: general, flu, COVID. So all of that has to be, every penny is accounted for in a particular category. And so the deposit can go at the end of the night and can go over to Heather, and it can be missing a piece of the data. not that the actual financial dollars are ever wrong, but the accounting for it can be wrong. We have a new staff, very new team. So it can certainly happen once, twice a week that they will do their reports. They'll put that in the safe. Heather will get those. She'll come back and say to them, I don't have reporting for this, or this doesn't match up. And so with a new team working and teaching how essential, making sure that every single penny is properly categorized and getting it to Heather right the first time so that we're not doubling up work. So we are using our resources effectively. So yeah, that's where that came from. And yes, with a new team, it can certainly happen once, definitely twice a week.
So is that 18% error or 88%?
Let me see where this is at. So I think we went out of a number of how many days in a month. And so I think that should be 18% error.
So the goal should actually be 10, 0 to 10.
Right.
Zero. Okay.
Okay. I think it's,
Okay.
yeah.
Yeah.
Yeah, I kind of took it as that was like 100%. You could have a very experienced team, and of course we're here.
Right.
That's not real.
Right.
That's not even, there's humans doing these, right? Still, right? Okay, like, you got AI back there doing this? I mean, that's just not real. I think that's numbers not.
And it was hard to kind of figure out like, okay, how, but it is having the data done correctly and done correctly the first time is essential. The A team does not have a lot of free time. They are maxed from the minute they walk in the door to the minute they walk out. So we need to efficiently do the job effectively and cut out mistakes where they can happen. And we have steps, we have a procedure, we have processes throughout the day that kind of help us collect the data that we need. So at the end of the day, all the pieces are there. So
we're going to state that in the positive.
Yeah,
So we're going to say David correctly done, and it's 82%. So then we're still red.
Yeah.
Based on what they're
less.
Yeah, that's right.
Less red.
Thank you for pointing that out.
Thank you.
9% from yellow. Much better than.
Yeah.
As hard as we tried to get this right and do our discussion today.
We are about halfway through. Does anybody need a short break, or are we good to keep going?
I wouldn't mind 5 minutes.
5 minutes? Yeah, we can reconvene at let's say 2:35.
I'm just making sure. And being
It's part-time.
Well, yeah, I get how these things.
Yeah.
I understand what they play.
I got my first check.
But
Yeah.
You're like,
Not doing much.
okay.
Yeah.
Well, now this really is public service, isn't it?
Yeah, I'm paying to do this job.
Truth.
Yeah.
Mayor doesn't get better.
Yeah.
At all.
Probably use more money
Yeah.
than commissions.
Just so you know. Well, and you guys have like this really fancy, like $6-figure, $200,000 city manager.
Yeah.
I don't got one. I don't got one at all. I don't got like a budget based on that. I don't got one. I got me, and I'm like, you like that to be like some desire, like,
Yeah.
and I can go do the full month, shake the hand.
Yeah.
Like, yeah, I'm like, how do you get that gig?
Yeah.
Like, yeah, I don't, anyway, you guys have some pretty extensive, apprenticeship programs.
Yeah.
I want one. We got some sled running we gotta do.
Yeah.
It'd be an apprentice, operator. Also, I think, Beverly's on the clock.
Yeah. I stopped in probably a week or two ago and said the.
Oh, did you? Isn't he a treat?
Yeah, yeah.
That's
So,
like one of his friends.
yeah, no, it was, yeah. I was just stopping to drop some signs off and he told me about everything.
Yeah, so, yeah, I
It
think,
was hard out.
yeah, he's got a lot going on.
Could be.
But yeah, Definitely, I can, you got,
Kevin, I think reached out to one of your people.
Oh, sure.
yeah,
How
I can-
many unscreened patients there are.
And the right guy, it really matters. I don't know if you guys have the guys or like, the right guy always matters, you know? We're real small, the right guy matters.
Oh, sure. Yeah. And,
Yeah,
So if you wanted to take that off.
I'll give you a.
yeah, that,
I think Kevin's already working on it. I
It
think
seems
Kevin
like-
already dealt with it a little bit.
Oh, is he?
Yeah.
With Cody?
But we
Cody
do,
Burns?
I'm assuming to be on.
Sure, okay.
Name.
Yeah, cause I mean, you probably, you're not in the.
Well, a
Day-to-day.
little bit,
Yeah.
you know, I mean, hey, I mean, you're moving on this. Okay,
Yeah.
cool. I'm talking to somebody at the water.
Yeah.
Yeah, that's-
Mhm, yeah. I'll use the restroom.
Let's just have some amount of billing clinic and those will help out, so.
It's all you personalized data, it'd be amazing, so.
Yeah, I will,
Approach to.
I also ventured into the internship when I'm PhD, so. We'll see.
Make that more formal.
Yeah. I tend to do that. So.
I'm gonna have to bounce a lot from three, but sorry, but.
Well, at least we're not here till 5.
I tried to like. fill
Well,
it.
I am.
This chocolate is really calling.
I tried to do healthy snacks. We are the
I-
health department after all.
Yeah, this is lovely.
I showed up for this chip thing, see it at all. Yeah, I don't, so I
Place some chips around here somewhere too.
feel like that was a misnomer, seeing apples.
I can't get that through my head. I had asked about it and then we got this and I was reading that and I was thinking like children's health improvement program. I was like, what?
Yes,
What do we do with that? And then I was like, Shannon, get it through. Like,
darn acronyms. They'll get
I
me
know.
every time.
She's now.
Internally, we can speak like that, but I need to remember that when we're not, when the document is being seen by others, that they need to be just.
Oh, the worst is the police. They'll come back and blah, 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 blah. I'm like, okay, we're gonna rewind a bunch of this. We had alphabets. We played alphabets and I don't know, what does any of that mean? I don't know, they got a lot of acronyms.
Be much better about not using acronyms, and that's been one of my New Year's resolutions is no new acronym.
I was a prosecutor for years and I swear every time I read a police report, I was like, this is something I don't know. Like, when am I going to learn this?
Like, that's the word, like you, can we talk in English? Guys, me, she's English.
When I first started at the state, I made myself an acronym cheat sheet. And over the years, it has grown to like, I've had to change the font to smaller to get it all on one page. It just keeps growing.
Commissioner Payne is our acronym, Hawk.
Yeah.
And she's done a great job about getting everybody to get rid of acronyms, right? And really has helped.
Those good for you, what's in that? The calories aren't good. There's only 3. They ain't gonna be good. That's not a very big number.
Yes,
Well,
well.
drink off you.
Carbonated water and 2%
Yes.
lemon juice.
That might be all right.
They're carefully cultivated. Not caring at all about what kind of coffee it is. So
Oh,
the instant
yeah.
coffee at the hospital, if it's sitting there for 6 hours, I would taste it.
You gotta have a third.
Yeah, I'm not I don't have.
What's that?
Well, you gotta have a third.
Coffee black Folgers from,
This is probably pretty good coffee. Fred doesn't, he does good, like high quality coffee.
Oh, yeah.
You guys usually are.
That really wasn't where he kind of thought he was gonna end that when he took the city. It's been great for us. That's where he
It's warm and it's.
had a whole different idea.
Yeah.
His body started to break down. I'm like, let's start using our brain. Maybe see if we can get you a job and use your brain a little bit.
Like a nice cup to hold.
Oh, it's a great cup to hold. Seems to have it, so.
you trying to get a specific methodology.
Forthcoming is the state Medicaid on
So we can just get rid of these old
or
ones.
anything.
Yeah. Those were preliminary. This is the most current.
But I haven't had field.
It's like I
Junk data, it's no good.
that seems like a
Here it
huge
is.
population.
This is not complete.
And also.
And neither is this as of right now. This is how statistics
This
work.
is still in draft form. Correct.
We have a little discussion about something called sample size.
That's a great question.
Ideally, we would know how many patients are untested at the primary level, and that would get a pretty good window.
All right, we will reconvene.
It's great. Trained back east and haven't had to think about it in a couple of years, 'cause it's not a problem in Colorado.
What's interesting here is you're always doing. From managing.
Are we, so we're still looking at these KPIs?
Yeah.
Okay.
Neva, I think we're ready to go again. Everybody's back.
Great. Well, I put up some just little bullet points here because I feel like the KPI discussion is maybe one we could like really go down the rabbit hole for a long time. And so I just kind of like laid some thoughts out here on how we can maybe like move forward through this. And then the first one, like not to go too deep down any rabbit holes, because we certainly could very easily, because there's lots of rabbit holes in here. It could be fun. I love a good rabbit hole myself. But just like any questions of clarification on the KPIs, like I don't know what this means. I don't know, why is this important? Something like that. Anything in the KPIs that is like that.
Can we assume maybe that these are all, like all the KPIs in one quadrant are more relatively at least seen as equally important by staff? Like they sort of all have equal impact within the organization, or measuring, I guess, impact within the organization.
They call this the balance scorecard. And so the way I would recommend you looking at this is that all 4 quadrants are equally important.
Mm-hmm. The quadrants, but then within the quadrants,
they're not in any particular order.
Okay, and they're all relatively, like, if we choose one, they're all sort of a relative important.
That's what we're asking you to do.
Yeah. I just wanted to.
We gave this set to you because these are what we think are important.
And it seems like some programs have multiple line items and some programs have one. And are there any that don't, any significant programs that don't have any KPIs?
All programs are represented. Plus department, you'll notice some department-wide KPIs as well, so.
And I'll also kind of add along to that question because people, even at the state health department, this is something that like comes up, is that like some of the programs aren't necessarily represented in the strategic plan. And the reason for that is the strategic plan is meant to guide the organization. And so some departments, they may follow things that they may have like a piece or fee that would then roll up into the strategic plan. But we don't always necessarily have one that's going to be, for each program that would be like, this is our goal to improve, maternal child health in the strategic plan. And so sometimes that's something that can, it's when people like see the strategic plan and feel like, oh, my program's like not represented, that's sort of the reasoning, but that's not meant to say that they wouldn't have an activity that, does roll up in some way.
I think, so for me, I'm looking at the operational quadrant and rural health at the very bottom, which is currently green. I think that is absolutely critical, in part because outside of cities, and certainly outside, like even maybe outside of our county, it's much easier for people to access care, I think, when they live closer to care, right? And so the rural outreach and rural prevention, I think that's not going to be replaced if we're not doing it, right? And it will, if we don't do that, I think our health systems will be sort of will have there will be an outsized impact on our health systems at some point, right? With more serious issues, more frequently, with more people experiencing them. And so I think I view that as a critical KPI within that area for those reasons.
Help those of us possibly just meet in the area. I'm assuming our public health infrastructure, just by virtue of size, is bigger than in some surrounding counties.
That is true.
Okay.
So Lewis and Clark Public Health is considered a large health jurisdiction. Our neighboring counties, Broadwater and Jefferson, are small. And so we often are structurally supportive and programmatically supportive to their health departments. So we do partner across county lines often. Which is why we listed Broadwater, Jefferson, and Marr counties in there, because we are actually contracted to do some work, but for obvious reasons, they don't have the same level of resources. So we do provide lots of service, consultation, partnership.
There's one I don't understand, under operational. The second one, number of elements, 6 in the cultural quality assessment in phases 4.
Yeah, so we do on a fairly regular basis, every couple of years, do a culture of quality assessment as a part of our quality improvement efforts within the department. And there are 6 elements in that assessment, and there are 6 phases. And the phases represent how well you're doing within each of the elements. So if we score between a 4 and a 6 within an element, then we're doing really well. If we're scoring under a 4, then we're not doing great. And so we want to see that in each of those 6 elements within the assessment, that all of them are between a 4 and a 6. And right now, only half of them are, only 3 of them. Out of the 6.
Was this the assessment that we went over several months ago that was through DPHHS?
No, that's our foundational public health assessment that we did.
Yes.
This is an internal assessment that we do as a part of our culture of quality efforts.
So have we haven't seen that, like we haven't seen that.
No.
Okay.
No.
So should that be under operational or should that be under people and culture?
So our quality improvement efforts are intended to improve our operations. So we have
low turnover, that sort of stuff.
It's typically programmatic. Like right now, we're working on a quality improvement project to help our suicide prevention program improve the way they do data collection and show of impact of the work. So it's our quality improvement efforts are almost entirely directed towards improving the way we do our business. So our operations.
Not staff.
Not staff.
Gotcha.
We have employee satisfaction that improves our culture around staff.
Okay.
Mm-hmm.
Any other questions on the KPIs for clarification? What about, so we discussed the rural health as being one that's particularly critical or challenging. Are there other ones that stand out as being mission critical on this list?
I guess mine's a question and critical and biased. The number of wells tested. So do we hand those out and rely on the customer and or citizen to take the water and turn it in? So we don't. So do we know if those have been tested or just been handed out?
That's a limiting factor that we have in that program.
Sure.
We know the number of tests that we distribute. We do not know if they are used or what the results of those tests are. It's an identified gap in data in that program that this actually prompted, because I pushed on that program to think about, so distributing our well tests is an action that we take, but I wanted programs to get closer to impact of the work that they do. So I wanted to know, well, how many of those results do we get back? And they said, well, we don't collect that. And it's we don't have a system in which to collect that. So we're going to start here, and then it's likely we'll grow. We're infants now, we're going to grow into toddlers, and we'll do that better because it's now been identified as a gap in our data.
Sure. So I think that, biased opinion again, that's mission critical because it's drinking water.
I'm pro drink.
Right. Yeah, yeah.
I think that's an easy one to calculate.
Drinking water.
And so I think that kind of goes hand in hand with the rural health as well.
That's good.
So I have a question. Staff developed the KPIs and the categories. Is there any reason, this is a question to everyone, is there any reason to not accept all of these KPIs?
Do you want to answer that?
I think that what you'll see is we will absolutely monitor all of these KPIs already. What I'm needing from the board is prioritizing which ones you want us to strategically improve, which will be our strategic plan then.
So we got to fix some of the list here.
So I think that's the process that Neva's going to try to get the board to, is prioritization. But to answer your question, this is draft, so it can be, if the board says, well, I don't think you need to be tracking that one, we would consider removing it. Or if we're missing one, we would consider adding it. But for the most part, this is going to be our balanced scorecard that we are going to monitor for the lifespan of our strategic plan and edit as needed. So if we get to the point where we can, instead of just documenting number of well tests distributed, we can get to the point where we're actually getting the results. So we may update that one over the course of time, but yeah.
So we need to pick the heavy hitters out of here for the strategic plan.
For the purpose of the strategic plan, which is the process that Neva's going to walk you through, is how are you all going to get to the point where you're going to give us a handful of priorities, because we're not going to work on all of them. We're going to monitor all of them, but we're only going to work on the priorities that you give us.
This is a resource allocation exercise, right?
And what are the implications of that prioritization? Is there anything that, like, obviously there's a finite amount of available resources, but is there any, I mean, I don't know if we have like program efficiency things or what we're taking away from other things by prioritizing one thing, prioritizing X, Y, and Z over A, B, and C.
There may be some of that.
Yeah.
Yes, there may be some shifting around because what this represents is really work happening.
Yeah.
So this doesn't represent anything new necessarily. What it does represent is the acknowledgement that there are some areas that we need to do better, which we can then strategically plan around. But if we get to a point where we're needing to prioritize, we can't do 10 things, we can only do 5. We will use the prioritization and our strategic plan to determine what it is that we will do and what it is that we may have to back burner. If we lose grant funding, if we get hit by another, God forbid, global pandemic, we will turn to the priorities that the board has said. We really want you to work on these things. Those will be what we prioritize over other work.
Well, and I think just to put a finer point on that I think these KPIs are distilled down even from what the prior strategic plan kind of was required, or I guess these are kind of distilled down from what the prior strategic plan was. And there's very few green on here, right? So like even these, while they're being monitored, the department cannot do all of these like at the same level. And I think that's the real, that's what they're being asked to do right now with our old strategic plan.
Yeah. I'm going to want to know from you which ones you want green, right? Because we're going to be doing the work, but we're not going to do the work at the same level across the board. We're going to put a lot of effort through very, very clear strategic plan into a couple of areas, and those will be determined by you all.
To me, the priority is red. if we're gonna plan for improvement, making things better, then we need to tackle the things that don't look good first. Because of the yellows and greens, judging by just the history of staff and the way they work, those are gonna move up. But it's the reds that need attention.
But those greens are only gonna move up if we don't take away
Or stay with it.
or stay where they are. Exactly. If we're gonna have to remove some resources to get those reds up, those greens may not be green anymore. So I think then the priority becomes, are those reds really something we want to quantitate or not? So I'm just gonna
some like objectivity too in some of these things, maybe something, that's red when, we look at it, really it's like performing at maybe like an acceptable level. Like these were just kind of things. And so there might be things in here just like, you know what, this may be red, but like our goal is, changing that, or maybe that's the same for some as well. And so it's kind of, again, in this activity, a little bit of, using input and using this, and then kind of like a triangulation, I guess, of, which ones stand out in these KPIs as like looking at this. And then also, taking what was identified in the SWOT from the staff and what we've talked about in terms of, what do our values look like? And so taking these three, like those things together and then trying to figure out, what do we need to look at and focus on and put resources towards in the next year. And so, again, there may be things on here that, are red that maybe is just like, that's, not as much of a priority. So let's change that metric.
An example of that is one that Commissioner Rolfe mentioned with 90-day reserve. We're way above the 90-day reserve, and he's like, I don't care. So that's red because it's above the 90-day, but it's also not a problem right now.
Yeah, I think we gotta be extra cautious because we don't know where the money's coming from.
Yeah, and so we'll do that in one of our next, steps after we kind of get through this part is we're going to decide, how we're going to prioritize these things. But I think the ask right now is like kind of, determining if there is any on this list that are really critical. And then like what would success look like if we were able to focus on the quote unquote correct ones? And then also kind of using those other resources that have been put together in terms of the SWOT and what we talked about in terms of values. Are we measuring the right things, or is there something missing off of this list? So a lot of things to kind of consider. So
I would also sorry, Sherry, were you going to say something? I'm sorry.
No.
Oh, okay, so I just heard a little noise.
Yeah, I was just taking a drink. So
I think under operational, one of the yellow metrics about midway down is number of 317 vaccines. I think that is super important. I mean, I think I maybe have a bias toward preventive services because I think they're effective and they save us money and they save us, they help people stay healthier for longer. And so for that reason, I think that is something critical that not only, again, if we're talking about our duty as a health board to consider the public, the community that serves people individually, but it has community effects as far as herd immunity and things like that, and protection of people who can't get vaccinated and things like that. And so I think that's important.
I would agree. To his point, yeah, the most inclusiveness, that providing vaccines and access to them to under and uninsured populations speaks to these things. This is very important. I think it should be one of the critical ones as well.
And I think kind of a lot of people, a lot of the individuals affected by that, plus a lot of the other categories are relating to children, and thinking about that as a foundational component for our community in future decades, helping provide a healthy foundation for children, whether it's maternal health related, which helps the moms as well, but also is such a critical thing for helping students get a good start.
Yeah,
sorry, just to clarify, are you saying that in relation to vaccines, or are you saying that maybe that should be a separate KPI in and of itself? Or so?
Well, I think it touches, and thinking like not all of them have a specific line item, but it touches on like 7 or 8 of them, I think. The lead levels, the vaccines, and WIC and home visiting all affect children.
Do we have from this list and looking at what we already discussed with the values, do we have a way to measure from this list whether or not the health department is living these values? Do those two things sync up?
I think some of these are obviously more corollary, like voicemails per day is probably not going to go into these as well. Like, that's not the direct line. Obviously, customer service matters and being accountable, but it's not the same as like we were talking about vaccine down or insured individuals, not as direct of a corollary. So I think
I don't know. I mean, I see what you're saying for sure, but I also think that one of the things that came up in the SWOT analysis is that the administrative team feels like they're not relied upon as much as they should be. And so if there were more, right, like I think you're right, like as it stands right now, probably that's correct. But if there were more delegation to the administrative team, then that might become a lot more important, right? And so, yeah, I think you're right, but I also think that could change if we're considering the dynamics of that particular team.
I think one thing for the customer service side of it, like we don't care about customer service in the sense of making people happy. We care about it in the sense of, positive feeling towards the health department in the community and willingness to rely on the health department as a resource. And I wonder if we have any KPIs that, and I don't have a great idea for it, admittedly, that capture that, like, I am satisfied with the services I received. Are we hoping that people will say yes to that if they, as like a stand-in for, I feel like I got what I needed to in a reasonable way? Just thinking about it in the sense of how do we capture community goodwill and reliance on the health department to achieve all of the ones in the operational? Because ultimately the other 3 boxes are supporting the operational box.
So in the financial box, I guess to touch on that, the electronic bill service turnaround time and the insurance payment posting, is that all internal or is that to the customer? So
it's all internal.
Okay, so
that's how we bill for and then receive money.
So, but it still goes to, I mean, it's still internal, but to external to the customer. So if they're not getting a bill on time or don't know what the insurance payment's going to be in a certain amount of time, I guess before I get into that question, were these timeframes built in, obviously by an executive decision? You as the team leader, or?
Yep. So these timeframes are
industry standard or customer based or capacity based?
Capacity based, definitely. So as our team has been short staffed since September, we have been able to maintain the electronic service bill turnaround is when we're posting. So the day you come in, how quick can we get that bill up to the insurance? We toggle between 24 and 72 hours. 24 hours is where we want to be. We want to be able to get it out the next day. When insurance payments come in, again, we want to be able to post those payments in a matter of days to be able to determine, does a patient owe? Because sometimes patients aren't expecting what comes back from the insurance. So yes, nobody wants to get a bill. Sometimes you go somewhere and, 4 months goes by and then all of a sudden you get hit with a bill for $500 and you weren't expecting that. So ultimately it goes back to this kind of fits into many things. Our operations, how quickly are we collecting the revenue that we need to be able to support what we have? And then how quickly are we able to get either statements out to patients or how quickly are they able to see that, oh, okay, great, I don't owe anything.
Yeah. So I mean, I think that would be a foundational piece that, you know, like you were just saying, the three boxes support the operational, but I think those two right there support not only from the business standpoint, the money going in and out, customer service, and then how we're performing as a facility. So I mean, I think that, you know, that's a driver, you know, from the business standpoint, more of, I guess, I mean, I don't want to say customer service standpoint, but I mean, you gotta have money coming in and out in an appropriate time with your customers to do business.
And is those two components relevant to the mission?
Is, I think, being financially stable, customer service, and
when we look at our mission, right, is to improve and protect the health of all residents, right? So to me, internal ops is great. It's a secondary metric to me as opposed to a KPI. Right? It's financial, it's operational. Mm-hmm. But if we're going to create a strategic plan based around our mission and our vision, I think the healthy people of the county is what we should try to focus our KPI identification to put into the strategic plan. Does that make sense?
If we don't have that revenue, we can't provide the service.
I mean, is there for both in it that we can have, you know, these are our operational, what we're trying to do, and then here is how we support the organization. Like here are the priorities the organization to get there.
Well, back to the question I asked earlier, you know, all of these are great. These are all great KPIs, but we can't put them all in a strategic plan, right? Well, and we can link everything back to public health.
And I think to that point, I think you make a good point, and I think I agree with you, because I think I wouldn't agree with you if, let's say, the goal was 24 hours and this was 2 weeks later, right? Like that would be very different. I don't know that there's too much daylight between 72 hours and 48 hours, which would not stand out to us as much if it were yellow.
Depending on the season, there's probably, 24 hours of daylight actually.
But I do think as far as, like what if we're looking at, okay, well, that's another day. That doesn't seem catastrophic to me. Maybe it is. Maybe I'm missing, but like, to me, that's sort of when we're talking about, okay, if we're going to prioritize something internal, I think it should be, I agree with you. I think this would not be it.
Well, on that note, and some really, really great discussion happening. So I think there's a kind of a good time to like move into this prioritization idea. And I'll leave this to Brenda, but I think some of these numbers have like flexibility. And so we don't need to get really, is it 1 day? Is it 3 days? Those are, some things that can kind of like get worked out, but really, how are we going to prioritize these? And so, continue to look at the SWOT, and then over here, the values, or it's like, is there anything that we're missing? But in terms of like, how are we going to prioritize this? I wrote down just one is folks were talking, but developing some criteria for how we should prioritize. So I'm just going to kind of explain my thought of what we can do for like the next 55 minutes or so. Because I really want to make sure that we're allowing opportunity for anything that is not already represented here, that it has space to be included as well. But for the next 55 minutes or so, we want to decide on what this prioritization criteria is. And so how are we going to decide what goes where? So is it relevant to the mission? Is it or is it ease of measurement? Is it impact to the community? So I'll leave it for you all to sort of, decide on what that criteria will be. And then on these Post-it notes over here, and I'm probably going to move over to the big board, so I'm glad that Brenda cleaned it off. So on these Post-it notes, I have all the KPIs that are They're written on here. So once we decide on the prioritization criteria, then we can move over there and then, we'll do that big graph with the 4 quadrants and then kind of decide where to place each one of these. And then after that, because, people come from different backgrounds and have different experiences with things, we'll also give an opportunity that like you as individuals will get to go around and vote on what your priorities are, regardless of where they are in the matrix. And so from that, we'll hopefully have, enough in between where things are falling on that matrix and what people have decided are important KPIs. So at this point, just really making sure that, we're not missing anything, because that's the last thing, that we want to do is to leave this meeting and be like, oh, darn, I wish that we would have had a way to measure, I don't even know, but, something, and have like a way to do that. So those are my thoughts for like the next time that we have together. Does that sound like a reasonable plan?
I have a question.
Yeah.
So is this going to be solid at the end of the hour? I mean, is whatever we decide at this meeting is going to be the way it is as far as priorities on this, or is it preliminary? And then are we going to have time? Because I'd like a little more time to look at it and categorize things and, next meeting, maybe ask more questions, better questions, because have it more organized. I'm just wondering if at the end of the hour, is it solid, or are we going to have another month to solidify this?
Yeah, well, it would be our hope to finalize it during this meeting. And, I think maybe we can just see where we're at the end of the hour. But, I have hope that we will come to a good consensus by then. But did you have any?
Well, we have a staff session planned in February, and a final strategic plan needs to be adopted by the Board of Health by April.
So thank you for asking the question, Sherry. I do think the staff has to put quite a bit of work in once we identify the priorities. And so I think with the timeline, this really, in broad strokes, at least needs to get done today. And then we can refine it a little bit more, I think, once the staff puts in the work that they need to before our next meeting. But we really need to get the broad strokes done today. Yeah.
Okay. So on that note, I would vote for the number one thing should be how it directly affects the health of the community. I think that should be a priority. The things on here that would directly affect the health of our community.
Talking about criteria? I think that would be, that's its impact on the community would be the direct impact of that. That's going to be the number one criteria.
What things on here is the health department required by law to do?
We're going to do those anyway.
Okay. We're
Couldn't follow the law.
No way.
So can we strike those off? That's what I'm hearing. I'm hearing we can strike through those. Just double your vote.
Okay. So just a couple ideas of here in terms of criteria. And so again, we're going to go through all the KPIs real quick and kind of place them on the map. But is there any other ideas? This is just one I wrote down, but relevance to mission, impact to the community. Is there another criteria that we want to consider?
I think there probably should be some kind of efficiency, kind of bang for your buck. Like there are things that can have an enormous impact, but at enormous cost that would take away from a lot of other programs in the process. So I do think that the sustainability and impact for investment.
Return on investment.
Thank you. Yeah, that's the term I was looking for. And do economics.
ROI management.
We have relevance to mission, impact to community, sustainability, and ROI. Do you want a 4? 4 criteria?
I gotta get 3.
Huh?
I think you're gonna 3.
3?
Well, we have 4.
Yeah, those, I think sustainable and ROI are kind of combined, aren't you?
Yeah.
Oh, I see, yeah.
They're brought up together, right? If you wanted to do something like that.
So are we gonna go through these one by one and vote on them? Is that what we're doing?
Yes.
Can we, sorry. You can try.
Sherry, we're gonna make sure that your votes are represented. So you and Sandy are gonna work together through the computer, and Sandy's gonna make sure your vote is represented on the board.
Okay.
Okay.
As far as impact to community, Sherry, are you thinking like immediate impact? Are we thinking long-term impact? I guess what is your ideal?
So I haven't really had a time to look at all these categories. I've been, flipping through them and kind of looking at them. But such things as, and I don't know if this is on here, for no smoking, they gave us a presentation one time, the tobacco use and all that kind of stuff.
Yeah.
What kind of an impact is that really having, on our community? Of course, it has to be long-term. So the lead thing, that's important, right? Okay, measuring those things for the kids, things for the mothers. I think those are really important things. I think that maternal care, aftercare, postpartum, screenings, those kind of things for women, is really a good thing. I think that has a positive outcome that is pretty measurable. So for that 4th category, we have 3 categories, is that right?
Yeah, relevance to mission, impact to community, and sustainability / ROI.
So I don't know if it's worth it, but to have the 4th category, the things that absolutely should be at the bottom of the priorities. So we can sift through those out and get the things that all of us think are important in the top 3 categories. Would that work? Does that make sense?
I think we'll get those through that process. Like, I think us doing this exercise, we will know what's deprioritized.
Okay, well, let's get going. Time's away.
Your question. I was kind of supporting her on the impact one side. I'm gonna answer. I would answer both.
Yeah,
they have to try to be both long term and immediate. I don't think it's one or the other on that. I think it's 100% both.
I don't want to derail, but I'm going to ask some stupid questions. So I do something like this every year where I work. We don't call it KPIs and stuff like that. We call it OGSMs, objectives, goals, strategies, and measures. To me, the KPIs are the measures. The objective is the overarching umbrella of what we want the health department to do. For me, that's sort of the mission and the vision statement. And then the values are, how do we accomplish those? Our strategies are, in this case, in my mind anyway, the individual programs. So to the point earlier about some programs may not be represented, and that's okay, because their program itself impacts the ability of the Board of Health, of the health department, to achieve their objective. Am I thinking about this right?
I mean, I agree in that it'd be, again, not to derail, it almost would be easier to think about it as a program, not a KPI, for putting it on the matrix.
So remember, the KPIs are, it's like taking a pulse check of our organizational health. How are we doing in the things that we're doing? Like, are we healthy so they call it a balanced scorecard for a reason.
Yeah.
And that's because an organizational health, you have to have all 4 in order to be a strong organization, and you can't do amazing things in the community and have impact in the community unless you are a strong organization. This process gets us to a strong, healthy organization that then allows us to do really great work.
So I guess an example of how I'm thinking, where does WIC fall in our prioritization? More than the specific KPI on the sheet, or is it?
Well, WIC will always be a program that we do.
Yeah.
But the KPI is how we're measuring their impact to the community.
And if I could just, because I think it's a really great conversation too. And so what Brenda was referencing, this is really sort of the blood pattern. Right? So if you're all the H's are high, that gives you an indication that sometimes it might need some more attention, but it's not a measurement of the corpus of the organization. There's one other thing you said. Oh, I was just going to draw attention. I always use the example when we were talking about balanced scorecard, why that balance is really important. And I come out from the for-profit world before I came here. And when you're working for like a publicly traded company, investors might look and they say, great, you're making a ton of money in the financial quadrant, but people really hate working there. And so it just draws attention to how important like that customer service, the people and culture, operations and financial are all piece of it, because if one of those is off balance, it goes to the other side. You may not be able to accomplish the great work that we do because you're going to have a tremendous turnover. People are enjoying the work, they're not bringing enthusiasm and activity to it. Or the customers have a bad experience when they walk in the door, so they're not going to have that faith and trust in us to provide those services. And each one of those quadrants really has a strong indication of how healthy we are without representing the entirety of what we do. But it's a good way to kind of look at the dashboard and say, yeah, we're doing okay.
And to your point, Lisa, when the board gives us priorities, we're going to turn these into measurable objectives.
Yeah. Right. And so for me, sort of like the KPIs are more like a work plan.
Well, that
already exists, right? Because you're already able to measure it for the individual program. So just because one of those isn't represented in our priorities doesn't mean it's any less valuable.
Correct.
It still supports the program.
Yeah. What you're going to do for us is tell us where you want us to put some strategic effort to be better.
Right. Yeah. Okay.
On that note, can I have something to say? So Lisa, I like what your comment. It's like the WIC program that's been around for a long time, and that's a federally subsidized program, right? Which a lot of the programs are. Okay. So there has to be metrics on that, to how why would they keep doing it, or why would you keep getting money if it wasn't already measured, the impacts to the community?
Well, a couple notes on that. That's a valid good thing to bring up, but also, so the KPIs, they are indicators. And I was telling Brenda before I came that it's kind of funny because we're, like I said, you guys are kind of being our guinea pigs of starting with these indicators first, because it is kind of showing us, where is Lewis and Clark, right now. So that's what the balanced scorecard is showing us. And so usually when we do the strategic planning, because we would start like what you just brought up with the goal, like what is our goal? And what's funny is, so we go through a different process, but what's funny is people usually come up with these 4 things with different words. And so we kind of already, know that and are bringing that in. And these are, just things that we're kind of bringing to look at the different parts of the organization. And then, you bring your expertise in kind of determining, which of these, or if there's others that we need to kind of focus on. But I put this up here, like maybe we can just kind of take this for a test drive and see how it's feeling for people. And so I was thinking about it, and I hope if this is okay, so I had to say sustainability and /ROI on one axis. And then maybe if we can agree that impact to the community and our mission are more or less the same. Does that sound reasonable? Okay. So just as like a little test drive, and so these are paraphrased. So fully funded capital improvement problems or plan, where would this go?
I think 0, because it's green. Like, I mean, it's a yes or no. We don't have a metric. It could be no, and it could be 2 percentage point. Like, I think the way that we're measuring that, if it's a yes or no.
Well, where would this go on here? Does it
I think
low
low for both.
for both?
And
As far
I
as
think
the
high
data
for
on
both. Because you can't have a program with no funding.
Yeah, no, yeah.
So what is?
You can have a program with 98%.
Well, right, that's my point is
Fully
like,
funded matters.
is just yes or no.
I think we're getting at, yeah. It's fully funded.
Funded capital improvement plan.
If it's at 98%, we are not meeting the metric, but
What doesn't the budget planning that we do every year ensure that we have a fully funded CIP?
Yeah, this is one of the things that the county insists of each department. And
You tell us how you're gonna fund it and.
yeah, we have to have
Yeah.
it's part of the budgeting process. It's demanded.
So does that go in the it's gonna happen anyway category?
or is that a board responsibility that really? But
I don't think it's a strategic thing for them to focus on. I think it handles at the other end. I think if we're focusing on the strategic initiatives, I think it's handled the other end, but it's kind of on the outside of the strategic initiative. Now, is there something that's going to be handled? I think at the.
No, I mean, I get that, but I think to Brenda's point, we have to have something in all 4 categories. Right? And so if the easiest thing and the most assured thing that we're going to have is a fully funded program, that's the basis for all the other stuff.
And fully funded capital improvement plan, I guess that's
like
not.
Replacing vehicles and.
Yeah, I get it.
Saving for building maintenance and capital improvement.
Yeah.
Its impact in the community isn't probably the greatest. I mean,
I would
you
say
need a vehicle to get around, but having newer ones or having them replaced at its impact isn't probably.
To replace
it. Yeah.
I have an idea. This is why I think we need to categorize all of this, because it's kind of in here a little bit randomly. Because we're never going to get anywhere. We're going to be jumping all over the place. And then pull the most important things maybe from those categories. Does that sound
well? I think we're working down the list as the staff sees, how these what quadrants these programs operate in, and so I think for the time being we need to proceed with that as it's organized in front of us. I don't know that we have time to sort of reorganize things.
Yeah, I can't see the board. That's probably why I'm saying this. I can't see the different quadrants and how they're.
It looks like a plus sign right now. If you could imagine that in your brain.
I can see that.
Yeah. I can
And
bounce
somebody,
guys.
she mentioned ROI.
Sherry, do you want me to take a photo and text it to you?
You can do that if you want. That'd be great.
Okay, let me go grab my phone.
Eva, it might be helpful to do the, like, at this end of impact to the community, it's a negative or, a negative sign and minus sign, like low impact. This is low impact on this end. And then it's high impact on that end. And then for sustainability, it's low sustainability at the bottom and high chance of sustainability at the top. That might help.
So then working within this framework, I would honestly put this one right in the middle. Its impact is medium but not acute, and sustainability is medium but not acute. We need some thought for it to go forward, but in any given year, if the answer is no, because it's a little bit off, that is not going to immediately cripple the department.
I gotta leave. Probably put blend testing high.
Thanks, Kim.
Yeah, I think that makes sense. And I think my issue with this is not that it shouldn't be a priority. It's that if we're measuring in a yes or no, if we're at 90%,
are we good or not?
Yeah, I think that's really more of my issue. I don't think it's pulling in a lot of variables, whereas something like insurance payment posting, ideal is 2 days, we're 8 days. What are all the variables going into that? I feel like that's a better pulse check of more processes happening within the organization.
I get that.
But then if you take it down to 90% this year, then next year you do 100% of 90%, and then we talk about it again, and it's.
And don't forget, you'll
Sorry,
get to
that was-
vote on your priorities up there.
I think numbers.
Because what she's trying to do is get you to think about where these KPIs fall within sustainability and impact, because that's the criteria you wanted to use. And then you'll get to vote on what you think are the priorities within that. So.
Hey, Sherry, what's your cell phone? I'll text you a picture.
Yeah, 406-581-31 667.
Okay. Okay, so I think that I agree with Dr. Nast. Any last thoughts about that before we move on? That API capital improvement plan.
You just don't want to be since actual funding is determined by the county.
Mm-hmm.
You don't want to be at cross purposes with where the funding is coming from.
Mm-hmm.
And it has been established. Lewis and Clark County is virtually one of the very few local government units in the state that places capital improvement projects as being highest priority, so that we aren't going out and trying to find money. We're planning and we're setting money aside every year.
Mm-hmm.
And it's part of the demand that as we set our budgets every spring, we're sending the word out. This is part of what we want you to plan for every department. So you don't want to be at cross purposes with that.
Yeah, absolutely.
Just in interest of time, I'm going to do something crazy and then we can come back to discuss. I'm going to give each of you some Post-its and then you can place them where you think, and then we can have a discussion where things are.
Okay.
Does that sound good? So I'm just going to pass them out. So, and there is a method to this madness as well. I'm just going to give a few to each of you. We'll see what happens. You guys look scared.
Yeah.
Everyone else is.
And Commissioner Rolfe, for the capital improvement plan, is the priority at the county level, is that like 100% funded? Is that?
Yeah, that's
okay.
Yeah.
So that's why it's a yes or no.
We have to budget for that though.
Yeah, that's it.
If someone feels like they have a lot, I ran out down here so we can priority. So for Sherry online.
If the county doesn't do that, we do that.
Yeah.
So if someone wants to pass them to Sherry to do as well, can do that.
So I can text.
Okay.
If that works, I can text to Sandy.
Dr. Nast, you have a lot.
I do. Here's 3.
Okay. So yeah, just for you personally see these and then we'll discuss. Here's Sherry. Oh, yeah. Okay, Sherry, Amber's going to text you the 3 and you can tell us where you want them to be placed on the board.
Okay.
So in my madness, green is finance because money is green. Pink is operational. Blue is customer service and orange is people and culture.
We're going to be disproportionate in this part.
Yes. It's a priority, nothing's.
So I like this pivot. I like this. Us doing this individually. Wait, what was the salmon?
Operational.
Okay.
So then the next thing, I'm gonna ask you all to take 5 stars and then put them on the ones that you feel are most important for you.
And what do I need to do, Sherry?
You want 5 stars?
I'll take 5 stars.
Will be color coded?
No color coding, just to put your stars on your spot.
Oh, okay.
So Sherry, so I can get the 3 up there for you. One of them is number of unplanned absences.
Yeah, that's a low priority, but I can't quite see.
Okay, so you're low impact, low sustainability.
Yeah.
Okay.
Daily
The next
daily
one,
deposits, yeah, pretty high on the list.
high sustainability, high impact.
I would say so, yeah.
Okay. And then the number of days of what
The
is this?
salmon,
Oh, sorry.
yeah, that pink one. Somewhere in the middle.
Open.
Oh, these are let me read it off the. I paraphrase, sorry.
Is that something?
It's.
I couldn't figure out which one septic needs was.
First days. Environmental.
It's like 50.
Here, this one.
Okay, it's percentage.
Days, and it's the number of days one, sorry. Was it down here?
Yeah, I can't read it, so.
Number of days environmental health open. Or maybe I just made that up. No, number of.
Permits,
What does it say?
Number. What did I do? This is I think it's this one. Sorry, average.
Oh, okay.
Average number.
So it's average number of calendar days that environmental health enforcement cases remain open from initial complaint to resolution or closure. So it's about our environmental health complaints and our enforcement of those cases.
my star on that one.
Sherry,
Yeah.
also, I could put you on FaceTime or video and then just get close to the. Oh, she can. Okay.
Yeah, and that one's fairly high, I would say. That's important to get those addressed and get it taken care of. So pretty high.
Okay. All right, there we go. Thank you. And now we, of all of the ones that are on the screen, you'll tell us what if you want to put it in the chat or just say it out loud, tell us what your top 5 are, and we'll find it and put your star on it for you.
That's why I was trying to get her to FaceTime so she could be close to the door so she could actually see. Yeah.
Yeah, sorry. Probably I might next month. Hopefully I can be a little more mobile.
You can see the spreadsheet up on your screen still, right?
Yeah, with the little sticky notes on it.
Oh, no.
No,
We're sharing the actual balance scorecard on your screen right now.
yeah, I can't see that.
Is that because we turned the camera?
No.
Try again.
So we're sharing that document. Can you see it now?
It's
we're sharing a document.
rolling. Yeah, it's rolling. Has started screen sharing. Sandy has started screen sharing. That's what and then it's rolling.
Okay. So when that pops up for you, those are all your options. And you just need to tell us where you want your 5 stars.
Yeah.
And if it doesn't pop up, let me know.
Yeah, it doesn't look like it's going to. So
can I email it to you?
Yeah, whatever. I got my phone and my iPad here, so.
You want me to take another picture of the board?
Sure.
Well, I think she's not gonna be able to read that. But I'll just send her the balance scorecard so that she can look at it.
5 stars.
Need some stars.
Oh, here.
You're supposed to do 5 of them, right?
5
Yeah.
stars.
Yeah.
5.
Do you have stars, Tom, or do you?
Yeah.
Like, that's okay.
Yeah.
So we're putting stars on on the sticky notes that are up there. The 3
Yeah.
different sticky notes, we're putting stars on those.
Yes.
And all
And the-
It's the KPI list that we're just picking our 5 that we want. So they're all translated from the KPI list that we have. Our 5.
So you're talking about the 4 pages of.
Yeah, but I'm sending you the updated one right now. Because
Okay.
the one in the packet was preliminary and we gave everybody the updated one, which I thought you were able to see on your screen, but I just
No.
emailed it. I just emailed it to you.
Okay.
Yes.
Excellent. I think it is, at least. Similar idea. I'm not saying to get the Christmas. Yeah. Good for Christmas shopping. Yeah.
Basically, my lead tested Lee's Helena. In Helena, lead testing. I moved there in the 2nd grade. I go to meet my teacher at the Main Street School, which is now City Hall, and they take me up to this room and tie a band around my arm and say, "Freeze the tennis ball, kid."
Hey. So we have a lot in the high area. And then we also have some that have gotten a lot of votes that weren't high. So I guess initial discussion, because we place these individually, is there any, I guess, like let's look in this area first. Are there any that maybe people feel strongly don't belong up there or go somewhere else, or have reasoning that they would like to provide for why they were up there?
Can we remove any that have like
0.
have 0?
Yeah.
Good idea.
Do we need to wait for?
Yeah, Sherry hasn't voted yet.
Oh.
So when you're ready, Sherry, let us know what your top 5 on that that doc I sent you, and we'll make sure your stars get put up for you.
Okay.
Okay.
Second, I'll put them back up if she.
School.
Just put them off to the side, maybe. Put them.
The strange vote being introduced the 2nd president. School profit.
Seems like January is the time for doing this because we're doing it more of a day.
Yeah. Which is just across all.
Who's kitten?
So should I just say it out loud? Ones I want to.
Yeah. Kitten.
So probably the average number of calendar days that environmental health enforcement cases remain open from initial complaint to resolution. Am I on the right track?
Yep.
Yes, ma'am.
Okay, I got that one.
Okay. Yeah, this percent of environmental health applications that are completed within required timeframes. Let's see.
I think that's septic
Number of
for me.
days.
I think it's septic for me.
Okay, okay, I got that one.
Okay, so that's 2, right?
Yes, ma'am.
Okay, I'm looking. I think the outreach to surrounding communities is one of my
I got it.
stars. Let's see, probably the number of adult venous blood tests in East Helena completed by St. Peter's Wellness. So I got 2 more.
Oh, this is looking really good.
Was it this one?
It's a lot. We cleared a lot.
We're closer than what we think.
Yeah, I think the WIC participation per month.
Okay.
Is that 4?
Yep, that's 5.
Oh, that's 5. Okay, I'm good.
Thank you.
Wow.
Thanks for your patience.
Thank you for your patience.
Okay. So that narrowed us down like a little bit more. And we have 20 minutes instead of right here. So we still have a lot. So moving forward, how should we pull from? So we still have a lot in the high, but we have some that have a lot of interest. And
Could we pull ones that have 1? Does anybody have reservations about that? I mean, because there are several that have 3 or 4 and even 2. Enough to work with within that group of 2, 3, or 4 stars.
well, maybe we can go through what's left on the board really quickly.
I think one way to do it too would be by color. So like, it looks like obviously customer satisfaction is going to be the priority in that, the both customer and employee. I agree with one.
I like that.
That
So
way
maybe pick one from each color.
Yeah.
That way we can do the non-operational ones. I think we can then kind of decide and then focus the rest of the time on the operational.
So then, and then rural outreach or
Well, so
I see
the
what you're
only
saying.
one left for blue is customer satisfaction. So like that's gonna end up being the
only metric in that, yeah.
logic. And then to pick something for green, we just have to sort of choose our priority there.
Insurance and CIP.
CIP capital improvement.
Yeah, that has to be a priority.
That looked like the insurance payment also.
Also has
votes.
Well,
Oh,
this one's
CIC has
3.
3.
Yeah.
Okay. Sorry.
So then we can sort of eliminate everything that's not the operational, which is the one that's gonna be hardest, so.
Yeah.
Yeah.
So which pink one has the most? There's 3 or
5 would be perfect.
which has 3?
Rick has 3 and then.
We're trying to end up with 5.
Reach
Has
has
3.
Yeah.
Ish.
Can we negotiate for 6?
Number of days.
I think like around there, but like, yeah.
Yeah. Well, maybe,
So
so
if-
we have
yeah.
3 in the high that rural outreach, WIC, and number of days of environmental health open to close. That's paraphrase. I don't remember the exact ones, but
Can we move those over with the 3 others? Okay, so that would be 6 out of the highest.
Yeah.
and so in remembering too, with these in terms of impact to community and mission and sustainability.
And they were
Does
all in
that
that.
change how anyone feels about those?
I think the basic breakdown of category makes sense. Something women and children related. The rural outreach is a very broad category, but certainly makes sense to include, and something that gets to the mission of water quality.
Yeah, the
septic system, et
environmental
cetera.
aspect.
I I personally not sure that I agree with the priority on the last one otherwise, but I mean, that's what got the most votes in that category, so.
Yeah. Days.
Can I also suggest that the CIP is a given, like it's gonna happen
Right.
anyway? So do you want that to be a strategic priority when you know that it's gonna happen anyway?
I would, can I say, that's kind of what I was trying to say earlier, is that if the county has said that we have to do this, it's gonna happen. I don't think it's a good pulse check on what's realistically happening. And I think something like insurance payment posting, that considers so many more business operation variables about how efficient we're at, and right now, that one particularly, the goal is 2 days, it's at 8 days. I mean, 6 days is a pretty substantial difference in that category, I think. So I would be in favor of swapping
CIP
the insurance payment posting for CIP if people were, I didn't vote for CIP, so.
I did. I'm on board with you. Switching.
And our CIP.
One of my stars is there.
It is a given. There's no
Yeah, it's a
question about
given,
it.
so that's true.
But we can't affect
and ability to
whether it is or not, really.
Right.
Yeah, you're right.
Anybody object for moving the insurance payment posting over as the green category in place of CIP, since that's going to be done? No objections?
Okay, makes sense.
Okay.
So I guess I like rural outreach. Reason being is majority of our population are rural communities. I mean, we have Helena and Lewis and Clark County. We have Clancy, East Helena are technically would be classified as rural communities. I mean, so I think that rural outreach is very important, in my opinion, just because that's, I mean, the North Valley is considered rural communities and there's 60,000 people out there.
I agree with you for sure. Is the last posted number of days environmental health open to close? Is that the average number of calendar days? That's 43 in yellow. So I think that one's yellow. 40, I mean, it goes, the ideal is
violations?
30. No, it's this one's.
Yeah.
I think the ideal is 30, red is 60, we're at 43. Environmental health enforcement cases, is that like restaurant inspections?
These are environmental health, so it's land use.
Land use,
Yeah,
okay.
so it's gonna be community decay. These are complaints that we have to resolve. So it's septic issues, it's community decay issues, it's junk vehicle issues, it's things like that.
I guess what falls under rural outreach.
So this is our prevention team. So it's going to be things like cancer control, tobacco prevention. We throw immunizations in that outreach, suicide prevention, mental health supports. What am I missing?
Like environmental stuff wouldn't be in there.
Typically it's that our prevention team are the ones that do the outreach, but they often will take department-wide information, not just. So it's an opportunity, it's that staff that does it, but it's an opportunity to take information about all of our department programs. So. Yes.
So we could use it as an umbrella?
Yes, absolutely.
I do also think it's very core public health functions, and to the pulse check idea, programs that are able to do good community outreach probably are functioning half decently. That'd be an assumption.
Yeah. So we have, I guess, like 6 high priorities right now. We could probably end with 6. It looks like we have the most salmon as far as priority. The other 3, the orange, green, and blue, I think those are set. Those are set. So out of the salmon, is there anything we want to trade out that we haven't discussed?
I think the last one is the big one for me.
Yeah, I think if we're dealing, sorry.
I was just going to say, so I sort of, when I was doing this on my own, linked the average number of calendar days for the complaints, which we have as the 3rd, with the percent of facilities with greater than 3 priority violations. To me, the violations is.
Those are licensed establishments. So those are our restaurants. So they're 2 different programs.
They're 2 different programs, but I'm wondering if one of those can sort of umbrella everything? No?
No, because the number of days for complaints, that's our land use sanitarian work
Okay.
and our
Licensed establishment.
the percent of facilities with priority violations, those are licensed establishments.
Gotcha.
So that's two different efforts.
So it looks like maybe septic permit would be related to number of days. Is that, or no?
Let me look at my grades.
SDQ.
This one.
As far as the impact on public health, are those within the same
Because it goes from.
or no?
I think they're a little bit different. I mean, licensed establishment, that sort of public health, right? So.
No, I'm sorry. I'm talking about.
Those are applications processed.
Yeah, so it's just.
And it's actually percent of environmental health applications that are completed within the time frame. So we have applications that come in for site evaluation, subdivision reviews and permits, wastewater permits. And those applications have to be processed by law in a certain amount of time, like the administrative rule and our on-site wastewater regulations say we're going to process those in a certain amount of time.
Okay, so
and we're at
they're 100%.
We don't need. So yeah. Okay.
You know, the thing that happened in the legislature with those health permits or environmental health concerns, where they said that that if 3 people within the area within a quarter mile, I think it is, of a property complain, then the health department is supposed to look it over and see whether it has a problem, or the commission can decide that they're upset about it and push it through. That's a brand new law that we may be trying to figure out and be part of this.
This is really trying to get at how long complaints are open before we can resolve them. That's what this is getting at. So what we have right now are lots of complaints that come in that we have very little control over helping them resolve it, and they stay open for long periods of time.
Okay.
So that the change in the ordinance and the change in the law doesn't impact that. It'll impact a little bit our operations around it, but it's really having these complaints that are sitting there unresolved. It's a problem.
Okay. So as far as the salmon, we have, I guess, 3 options that are not included that have 2 votes: septic permit, number of children with lead level testing, and environmental health apps. Is that what that is? Applications. Does anybody feel strongly about those 3 that are not pulled out yet, as far as those 3 salmon with 2 votes?
Children lead levels.
And Kelly's not here, and he did. I don't know.
He did one of
Start.
That was his start. Oh, okay.
Well, I don't know if it got put on there, but that was his vote.
Yeah.
I don't know if we
I don't think we assumed that voting.
Did anybody put stars up for Kelly?
No.
So we should put 2 stars up, one on the adult blood lead and one on the children blood lead, because that was, as he exited, he said
that was his
those were his priority.
Yeah. So I think the number of children with lead level testing, then that would tie that with the 3 salmon that we have. So we need to make a decision amongst those 4, because more than 6 would be too many, I think, probably.
It becomes very burdensome for us to really have strong impact in more than a handful of areas.
I think if we're rating it by community impact, the lead level is more than the complaints.
I think, complaints open to close. I guess, are these emergencies? Like, is there raw sewage leaking into,
not typically emergencies, but they are troubling.
Okay, Sherry?
So, Drenda, do you have to be neutral while we're doing this? Or can you chime in on something that needs to be a priority?
Well, I'm happy to give my opinion, but I really do empower the board to make the final decisions.
I already tried that, Sherry.
Oh, darn.
Yeah.
Institutional memory. Which ones are perennially neglected?
So
I guess, go ahead. I was going to say, I mean, testing children for lead is very important, but are we looking at just one area instead of the entire community of Lewis and Clark County, Broadwater County? I mean, it is very important, don't get me wrong by any means, but I just mean, this is the entire community.
For context, all children by WHO and CDC guidelines get tested at 1 year of age. And that I think is included in that. We have a specific population that is high risk, but it is a general thing as well.
Sure.
This represents our specific work in East Helena for the high risk population.
So at some point, if children are receiving medical care, they will get tested for lead within a year.
Right,
okay.
yeah.
But that would be a year, and this would probably be older children than a year.
Any and all children and adults in the East Helena area our goal is to test as many people as we can in the East Helena.
Don't tell Kelly I said that.
How about maybe let's try this since we have 5 minutes left, and try to get to some resolve. And again, this will go back to the health department staff to develop those, strategies to implement these. But maybe we'll go through these salmon ones one by one, and we'll just do this by a show of hands. If you feel like, so in keeping in mind that we're, looking at maybe eliminating one, is that the idea?
And Sherry, I just sent you a photo of those final ones.
Okay.
So just by a show of hands, if you had to get rid of one of these on this salmon list, who would get rid of the number of children with lead level testing?
Quick follow-up question on that. If the health department doesn't focus on that, who does? Aside from their primary care.
Not in East Helena. It is our responsibility in East Helena. We're under contract with the EPA because of the Superfund site to do that work.
Yeah, and they're still going to, like Brenda said, we're still going to monitor these things, but which one is just we're gonna really hit it hard to make some improvement in this area. So none of the things on this list are getting, left behind, that we're not gonna test for lead anymore. But we're just asking if we had to make a decision, of what we're gonna put the resources behind, which of these would be. So to just get rid of one in terms of priority on the list, but who would opt to 86 this one? Sherry, do you have a question or are you voting?
Right.
Yeah, I was just gonna say, I would get rid of if it's being monitored, let's see, the lead level thing you have to do, right? Because you're under contract.
But I think the one thing from a public health standpoint, it sounds like there's a decent amount of data and things that we don't have that could potentially improve that program with additional effort.
I just want to add really quickly, I know we're voting, and I want to get to that. The very bottom one, number of days with environmental health open to close. I was just asked Lisa, it sounds like there are a lot of factors that go into that we can't control as far as their compliance, the compliance component and people getting up to speed. I don't know that that's the best metric for us measuring our organizational health, just because of that, because of the external variables that can impact that timeline that we don't have control over. So I just wanted to mention.
I agree.
That one to pull out?
Yeah.
I mean, I will probably be able to pull it out. Yes.
Yeah.
Do people agree with that? Pull out this one because of control?
Yes.
Yeah, it's kind of a customer service thing. I mean, it just seems like, if people get frustrated if things take too long.
I think that's one component of it for sure. But I think that if somebody has a violation or if somebody has a compliance corrective action plan and they're dragging their feet on it, we're not going to close that. That's not going to be resolved.
Think about the North Montana issue.
Yeah. Yeah.
And we can't hold anybody accountable because there's nobody that owns the property right now. The property owner is deceased.
And
that's an example of why, that's a case that's been open for a long time, many days.
Yeah.
So.
I think this new law that was passed there seems to be a little bit of interest in setting aside some money to fund it and then attach a lien to the property that we have to.
Mhm.
So
Good idea.
That might move it along a little bit.
I think that's a great point. I'm just concerned about us measuring our organizational health by a metric that is so directly impacted by these other factors.
All the other stuff
that we can't control.
Yeah, that makes sense.
My only problem is now we don't have anything environmental.
Are there any environmental ones that jump out?
Well, the one
super overarching?
Yeah, the one I think is important is the licensed facilities with more than 3 violations. And it's a red category.
I
ran out of dollars.
Well, the well
Yeah.
testing, if we're not collecting data, then why do we do it?
I think, yeah, I mean, I think all of these are important, right? And we had 5 stars. Nobody put a star on that, right? And so I think
No,
at
I
a
get
certain
that.
point, this is not going to be perfect. We can't do everything. The department can't do everything, and we have to make this decision for the staff to know what to do.
Well, and also if it makes people feel better, and now we're a minute, and I hate to interrupt a good conversation, but was the intention that this is a 1-year plan, you know, and so I think that, you know, this is, you know, to have, you know, maybe 6 things, you know, still a lot to focus on.
My intention with 1 year is that they would be 1-year strategies. Our goals and objectives weren't going to change unless
1-year strategy.
they really needed to. But our strategies would be 1 year straight. 1 year at a time, we would put energy into strategies to achieve the goals and objectives.
But we would have an opportunity again in a year if, for example, that particular metric is now 25% instead of 56% on the facilities being monitored, that at least we're looking at it again.
We will be looking at all of these.
All of these, yeah.
Can I ask another quick question on it? Would improving that metric help with the increased discussion at legislature?
I'm not sure. It would help the restaurants be in better compliance with the food safety.
So we're 2 minutes over. Can we get some consensus here? Right now, it looks like out of the highest votes with a good distribution across quadrants, we have number of children with lead level testing, WIC, rural outreach, percent employee satisfaction, percent customer satisfaction, and insurance payment posting timelines. Those are 6 KPIs that seem to have risen to the top. Does anybody have any objection to those being the final 6?
No.
No.
Is 6 too many, Linda? Is it manageable?
I wouldn't do more than 6.
Okay.
I think 6 is manageable.
We wanted 5.
Yeah.
Right.
Okay. Well, with that.
Yeah, sounds good. Yeah, well, yeah. Thank you all. We are adjourned. Thank you. Thank you so much.
Thank you.
That was great.
Yep. Thank you, everyone.
Thank you, Sherry.
Thanks, Sherry.
Yep. Sorry about
Feel pronounced.